and we know the nutrients. And these nutrients, when they're obtained and utilized, the result is usually growth, maintenance, and repair. And repair. And the nutrients are basically known. These are basic carbohydrates or sugars. We have the proteins, we have the fats, vitamins, minerals. So these are basically the nutrients that the body, gets after utilizing the food. And then we also have another word in our topic called hypertension. What is hypertension? Now, hypertension is basically having high blood pressure. Now, the normal is usually 120 over 80. The normal 120 over 80. Hypertension is measured at 2 points. The higher point or the top point, which is the systolic blood pressure. Now, systolic is when the heart contracts. Remember, when the heart contracts, it releases a lot of pressure onto the blood. So the blood flows so quickly. Why? Because it has to move throughout the body, the entire body. And then when the blood is coming back, there's also another pressure that's measured there, which is called diastolic. So high blood pressure is measured at 2 points, the systolic and then the diastolic. You get it from when the heart contracts and then when the heart relaxes. Now, usually the norm, it should be about 120. And if it exceeds the norm, it should go slightly higher, maybe by 5 points or a few points, and then the lower by 5 points as well. So when it exceeds high to 130, 140, and it's consistently high, then somebody may qualify to be what? Hypertensive. Now, usually when we talk about hypertension, people don't know what it literally means, but I've explained to you what it means. Your blood pressure being high. Ideally, when God was making your blood vessels and your heart, it made sure that the blood should move at a certain blood pressure, 120 over 80, and maybe below. You get the point? Now, unfortunately, many of us, because of so many factors that we shall be looking at tonight, is our blood pressure goes high. It goes higher. Now, high blood pressure or hypertension is one of the leading cause of death around the world. And today, globally, about 1.28 billion people are known to be hypertensive. That's a high number, 1.8 billion people. And surprisingly, that much of those numbers are in the low, middle income countries like Uganda, Africa, most to say. So most of these people are in Africa. Now, the danger is that, like especially in Uganda, 1 out of 4 adults is known to be hypertensive. You're hearing me? Now, that's terrible. Someone may ask, is that important? Yes, it's very important. 1 out of 4 adults, you count 4 adults, one of them is what? Hypertensive. And that's terrible, That is very, very terrible. That's according to the recent Uganda Health Demography Survey that was done around 2016. And now the biggest danger is that they that are hypertensive are not even aware. That's terrible. You get the point. We have about 80% of those who are hypertensive and aware about their hypertension. And that is so, so hard. And you know what? Usually when we do outreaches, Heart Institute, one of the things we do is we do regular outreaches in several places, region referrals, and everywhere where we're called. And even if we're not called, we do, outreaches. And one of the things we do in our outreaches is to do health audit, blood pressure measurement, nutrition, and so many things. You get the point. Even this time in around September 29th, which is the World Heart Day, Heart Institute will be celebrating it on the 3rd of October in Entebbe. That's where we're going to be. We're going to be celebrating the World Heart Day. And hypertension is one of the things we're going to be checking out. Very, very important. Very, very important. So what happened is this. We have lots of folks working unawares about their hypertension. And the moment you have hypertension and you're not aware about it, it has risks. It has risks. There are what we call complications. Don't worry about it. Control it. It is going to begin to damage your heart. Before you realize, we have something we call cardiomyopathy. Your heart enlarges. Before we realize you're in heart failure, before we realize you have a heart attack, before we realize you have a stroke, before we realize you have several problems, several cardiovascular diseases. Why? Because of one single thing called hypertension. Why is it happening? You didn't know about it. And because you didn't know about it, you couldn't manage it. You can't control it. So that's terrible. And that's why I call upon all Ugandans and the world over, especially Africa, to endeavor that you know your blood pressure. And it's simple. Just have a blood pressure monitor back home. Research has shown that people who own blood pressure monitors back home have their blood pressure controlled more than the people who don't have blood pressure monitors back home. And that's why we encourage most homes or most families to endeavor to own a blood pressure monitor back home. Very important. By so doing, it's going to be so easy for you to control your BP. Surprisingly, out of the people that are treated for blood pressure, about 21% have their blood pressure controlled. You get a point? World over, about 46% of the people are managed or are treated for high blood pressure, and amongst them, half of them have it controlled. Terrible. So, and this is why we need to look at the factors. Why is it that it's so hard to control blood pressure, irrespective of the treatment? Some people are on drugs, several drugs, but even then, they have challenges controlling their blood pressure. And as a result, they have complications, which eventually may lead to death. You get it? Uh, so we've looked at a definition of hypertension. We've looked at the definition of nutrition. We've seen a little bit of epidemiology, and then we have to look at the causes. What exactly causes hypertension? Now, hypertension is caused by several factors. We have predisposing factors, and one of them is obesity. Obesity is basically being big. You're big. In other words, obesity is measured by using BMI, body mass index, and several things. But one of them is body mass index. The moment your body mass index exceeds about 25, then you're obese. You are obese. BMI, what we know, BMI is a parameter we use to know whether somebody has the right body weight or the wrong body weight, whether somebody is obese or normal or small for age. And BMI is basically body mass index. When we're calculating this, we use weight over height, and the height is usually in meters, and it should be squared, and then the weight should be in kilograms or even sometimes pounds. You get the point. So when we get something to do with about 25 and above, this is somebody qualifies to be obese, and this is terrible. So this is a parameter we use to see if somebody is obese or within normal weight or low weight. And the moment it's excess 25, which is obese or obesity, somebody should check it. Why? Because it's a predisposing factor for hypertension. Now, and in addition to the BMI, we have what we call waist circumference. Now, waist circumference is around the tummy. Folks that usually have big tummies is a predisposing factor for hypertension. Ideally, for male, your tummy shouldn't exceed about 102 centimeters, your waist circumference. You shouldn't have a tummy. You shouldn't have a tummy. It should be flat, It should be very, very flat. You see, because every time you have a tummy, you're affecting the heart, you're affecting the organs around the ones which reside around here. You're affecting these organs, including the heart. So it's important that you have a flat tummy. And if you have a big tummy, it's important that you fight it and flatten, it should flatten. Then the other predisposing factor of hypertension is diet, which we shall be talking more about, diet. And every time we talk about diet, we talk about three important foods, as we shall say. You see? But also another predisposing factor is drugs. Some drugs will predispose you to, hypertension, including cannabis or marijuana. But also alcohol can also predispose you to hypertension, cigarette smoking, nicotine, tobacco smoking. And that's why tobacco has been banned, everywhere in the world. You get a point. There are few countries that take tobacco, but it has been banned everywhere in the world, in or every place. They don't like tobacco. Why? Because of the challenges or it brings, especially to do with hypertension. You get a point. And the other thing is which is very key, stress. Now, stress is so key. Stress, let me write it down here. Stress is very, 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 very important. And we shall be looking at it in detail, in detail. How does this stress thing affect my blood pressure? You get the point. And once we have this in check, we can control the blood pressure very, very well. Another predisposing factor is inactivity. I mean, folks are not active. We have folks when they get a little bit of money, they don't want to do work, they don't want to work, they don't want to go upstairs, they don't want to, they're lazy. I mean, the more money they get, they become lazy, and as a result, they become obese, and and eventually they get hypertension. Very, very key. Now, very quickly, let's look at diet. Now, how does that, and this is our topic tonight, nutrition management for hypertension, because I do this quite every day, amongst my clients back in the hospital, and I manage the hypertension. Surprisingly, drugs alone may not manage your hypertension very well. Yeah, that is something to take back home. Drugs alone may not manage your hypertension very well. Drugs and nutrition combined or used together or used hand in hand will help your hypertension work very, very well. So when we talk about diet, what exactly are we meaning? Now, there are three important foods or nutrients that we should put in check when it comes to diet. And every time we design in these menus and talk about the different diets, we're targeting three types of nutrients. Nutrient number one is sodium. Now, sodium is very, very important. You've heard about the different types of diet, the DASH diet, and then the Mediterranean diet, the portfolio diet. All these types of diets are targeting three major nutrients. Once these nutrients are put in check, once these nutrients are checked out, then hypertension will get down. You're hearing that. As a matter of fact, not every hypertension should be treated with drugs. Absolutely true. I mean, if a young man walked in a doctor's office and is about 25 and is maybe obese and he does not do physical exercise, he lives a sedentary life, is 25, is a little bit obese, maybe a BMI of about 28, and he has hypertension of about 135, of about 85, you get a point. I believe it wouldn't be smart to rush that person, all factors constant, assuming this guy is not diabetic, he's not what, but the only thing about him is the blood pressure is a little bit high and he walks down in the office. And then I don't think it would be smart enough to start this fellow with drugs. It's important to go lifestyle, including diet. You get the point. And then have to check him regularly to see that the blood pressure goes down. And I believe that it will go down just by these simple things, the diet and the lifestyle changes, which as we're going to be saying. You get a point. So nutrition becomes very important. And as we were saying, the first nutrient we're looking at is sodium. Now, sodium is amazing. It's important in the body, first of all. We need it for fluid balance in the body. We need it for lots of chemical work happens in the body because of sodium. Remember, it's a salt. It helps in coordination of the body. It helps in electrical impulses and stuff. But if used in excess, it becomes detrimental to your body, especially the heart and hypertension. Now, once sodium is excess, of course, the major source of sodium is salt. Salt is basically sodium chloride. About 40% of it is sodium. You get the point. And once it's excess, if this salt thing is excess, it increases blood volume. You get the point. Where it will increase blood volume, it will cause a lot of fluid to flow towards the body, thus increasing what? Blood volume. And once the blood volume is increased, pressure will go high. You get the point? Pressure will do what? Will go high. And that's why it's imperative to reduce. It's imperative to reduce sodium intake. There's a question that came in here, but I'll check on it later. Let me continue. It's imperative to reduce sodium. You get a point? Now, it's very, very imperative. The moment you reduce sodium intake, that means you're going to reduce the amount of fluid going into your blood, and that means you reduce the amount of volume of the blood, and by so doing, the blood pressure will go down. You're hearing that? So how do you do that? Number one, the way you reduce sodium is reduce it. How do you reduce it? Make sure you take, the WHO recommends about 2.4 grams. That's about a half or a quarter teaspoon of salt every day. Very little salt. You get a point. So one of the ways to reduce salt is make sure you don't put so much salt in your food or don't add salt in your food. Assuming you're given food and you tested no salt, don't add salt in it. The other thing of how to reduce the salt is read on the labels. Take time when you go to the supermarket to buy food. Take time and read on the labels. Find out how much salt is in. You get the point? The other way you can reduce salt is avoid adding salt to some foods. For instance, if you're taking avocado pear, don't add salt in it. If you're taking a boiled egg, it's not important to add salt in it. If you're taking vegetable salads, instead of using salt, you could sprinkle on a lemon or vinegar or stuff like that. So in so doing, it will help you to reduce salt. You get the point? Reduce salt. And the moment you reduce salt, that means you'll be reducing the volume of water, which thus the volume of blood. And as the volume of the blood goes down, the BP will go down. Surprisingly, some of these drugs that some of you are taking and some of our patients take do more or less like what we're talking about now. You get the point. You've heard of drugs called diuretics. Diuretics, the likes of spironolactone, the likes of Lasix. What they're trying to do is to reduce the volume of water. You get the point. They work in such a way that they're reducing the volume of what? Of water. And once they reduce the volume of water, which goes to the blood volume will go down and the BP will definitely go down. You're hearing that. So you see the drugs could work the same way as checking out your food. So if you check your salt level, your blood pressure will go down by reason of your volume, the volume of blood going down, which the same thing the diuretics will be doing. You're hearing me? The likes of prenolactone, the likes of Lasix. You get it? Yes. The other important food. We've been seeing salt. So where's salt from? Salt is found in food. Some foods have a high salt, especially processed foods. Now, this thing started way back in 1950s, I think after the World War II, whereby there was a challenge of food amongst the soldiers. So many companies arose to design foods that were packaged, processed foods, so that they make it easy for the soldiers to access food, which is high in nutrients and yet not bulky. So processed food started way back in the early 1950s after the World War II. You're hearing me? And the challenge about processed foods that they have preservatives, and most preservatives is highly in sodium benzoate. You've heard about sodium benzoate. So every time you're eating a processed food, food that is pre-made or convenience food, most of them have a lot of salt in them. Why? Because the salt is a preservative. You're hearing, which salt will increase your fluids in the blood, fluid in the body, thus blood volume, thus hypertension. So you see, so by just checking the amount of salt you take will significantly bring or manage your BP very, very well. And as a matter of fact, even when you're on some of these drugs like diuretics, if you just checked the salt level, the dosage of diuretics, the likes of spironolactone, the likes of Lasix, furosemide, will significantly go down. You hear him, and that's a tick for you. Why? Because every drug would have probably side effect and stuff. So the more you get it down, your cardiologist, your doctor will get it down by reason of eating properly, the better you are, which is a tick still. So that is nutrient number one. The other important nutrient that we must check every time we're talking about nutrition in hypertension is glucose, sugar. Very, very key. Very, very, very important. Now, what happens is this. Every time you take sugar in the body, the pancreas produces, the beta cells of the pancreas produce insulin. Insulin, boom, goes to the blood. Its role is to manage the sugar, bring it to norm. You get the point? And it brings it to norm. Now, the more that is done, and of course, when it changes, this sugar is turned to fat, it's turned to glycogen and stored. You get the point? So every time you're taking sugar, the pancreas gets to work, insulin comes to work to bring the sugars down, the sugar is stored. So the more you take a lot of glucose, the more you put the pancreas at work, the more you put the beta cells at work. And guess what? The sugars, the glycogen will begin to set on your blood vessels. You understand what I'm trying to say? Yeah, including cholesterol. You get a point. Cholesterol is made by the liver, of course. Much of it is made by the liver. But even the diet itself, including the glucose, can predispose you to high cholesterol levels, which will eventually narrow the vessels and thus hypertension. So sugar is very, very key, and we need to really, really figure out of how to bring it down. And we all know where sugar comes from. Sugar, importantly, comes from food, carbs, carbohydrate foods. potatoes, sweet potatoes, rice. You see, we have about the carbs. We've had about the simple carbohydrates and then the complex carbohydrates. Now, simple carbohydrates are basically the refined carbs, and those are quite risky. You know why? It's because it's the entirely sugar. It's glucose in it more than anything else. You get the point? For instance, rice, which is white, has more glucose than probably anything else. Bread, which is white, has more sugar than anything else. You get the point? So the challenge is these simple carbs, the refined foods, you know, white rice, portion number one, this maize meal, portion number one, uh, wheat, white wheat and its products. You get the point. Potatoes, I mean, the Irish potatoes, they are high glycemic. Basically, anything that is processed. We have two sources of food, carbohydrate foods. We have carbohydrate foods that come from the garden directly to the kitchen. Those are a little bit safe, apart from the potatoes, the Irish potatoes. Then we have the carbohydrate foods that come from the garden and then to the factory, and then afterwards to the kitchen. Now, those are the ones you need to be careful about. You get the point? You need to be careful about. And the trick is easy. Reduce it. The trick is easy. Reduce it. You get the point? Reduce it. And you can modify it, or you can get an alternative. For instance, bread. We have two types of bread. We have the brown bread and the white bread. Instead of going in for the white bread, go in for the brown bread. You get the point? And what I mean by brown bread is the unrefined bread. It's usually rough and brownish in color. I don't mean the cake bread, which people paint brown and stuff. I mean the unrefined bread. You get the point? So if you want to take a chapati or a mandazi or samosa, then go in a supermarket and look for brown wheat or whole grain wheat, and then use the whole grain wheat to make the brown chapati bread, make the brown mandazi. I need that. It has less sugar compared to the white one. You hear me? Likewise to rice. Instead of choosing the white rice, go in for the brown rice. You hearing me? Likewise to lots of wheat products, like I said, rice, posho, this class number one. We're going for class number one. It has a lot of sugar. I mean, it's beaten and refined so much, and then the sugar, most of the fiber is taken out, and the roughage is taken out, and some vitamins are taken out, even some minerals are taken out, and then they only leave a big percentage of sugar. Now that's risky. When sugar is excess in your body, it triggers off insulin production by the pancreas and then stored as glycogen. The more that is done, the more your cholesterol go high, the more you become obese. And guess what? Eventually your pancreas will give way. And as a result, you have hypertension and then boom, also DM comes in. You get the point? So it's important that you turn the sugar down as much as possible. It is important. Turn the sugar down as much as possible. Now, how do you do that? Like I told you, for instance, your breakfast, instead of using white sugar, the crystal sugar, use brown sugar, use honey, use stevia, the stevia sugar, which is amazing. It's amazing. Stevia, it's well, processed and stuff, and it's sugar. It gives you the taste of sugar or sweet taste, but no calories in it. You get the point? So these are alternatives. They're alternatives. Besides, you could even take tea without sugar. You're hearing me? And by so doing, you're reducing the sugar so much, so much. And once you do this, trust me, you will be doing so well as far as your hypertension is concerned. And then, boom, you'll not have hypertension or you manage it very, very well. Yes. Uh, the other way you can reduce sugar is do the fruits. Do the fruits, do the fruits. And then we have what we call a healthy plate. A healthy plate. A healthy plate is usually round, you know. If you did something round like this, and then I don't know if you can see, yeah, you see the cycle. Good. And then you do we have somebody talking?
David, of course, to mute. David, of course, to mute.
Sorry, I don't hear somebody talking. Hello. Okay, should I continue?
David, of course, to mute his microphone. Okay, thank you.
Oh, David, of course, could you? All right. If your mic is on, please mute it, so that we proceed. Thank you. Now, I was saying to follow a healthy plate, and a healthy plate is round. You draw more. Of course, some plates are square and oval and stuff like that, but the common plate is a round plate. Now divide your plate into four parts. Four parts. The first part is the veggies. The second part is the fruits. The third part are the proteins, and then the fourth part are the carbs. You get the point. Now, unfortunately, you can see this. Yep. Somebody. Good. You see that round plate, and then you see each quarter, the quarter of veggies, the quarter of fruits, the quarter of carbs, and the quarter of proteins. Now, every time you pick your plate to eat, every time you pick your plate to eat, make sure your plate is divided into four parts. You get the point? And ideally, the largest part on your plate should be fruits and veggies. Now, unfortunately, here in Africa, the largest part is carbs. The source is not seen. There are literally no veggies at all, and you hardly find a fruit, on the plate. We take a lot of carbs. An average plate of an African person is a lot of carbs. And no wonder we're getting obese all the time. No wonder we're having this hypertension skyrocketing all the time. Why? Because of our diet. So I suggest that we change the way we eat. You get the point? We just have to check this plate. Let's do more. Surprisingly, world over, we have some of the best fruits and veggies. That is the most surprising part at a very, very cheap price. You hear me? Very, very cheap price. We have amaranthus, we have nakati, we have dodo, we have asparagus, we have lots and lots and lots. You hear me? And at a cheap price, surprisingly, some of the prices here are unbeatable, unbeaten all over the world. So why not adopt this plate? You see, but I don't blame you. The thing is that we don't have the knowledge sometimes. The Bible says, my people are destroyed for lack of knowledge. Sometimes we don't know what to do, But I challenge you tonight. If you're going to manage your hypertension, if you're going to live a hypertensive-free life, endeavor to adopt this plate. Eat more of fruits and vegetables and sauce. And eat little or even no carbs. Now that's a little bit hard. Even no carbs. I usually tell my clients that a feast. You see this feast here? A feast is sufficient. Whether you're eating matoke and eating karo or chapati or stuff, carbs, a feast is sufficient. Now, of course, some folks are like, I'm not going to get satisfied. Now, it's not about getting satisfied. No, no, no. We eat to live. We not eat to fill our stomachs. But besides, if you want to get satisfied, you can use the fruits and veggies to make you satisfied, or even the sauce. In Western world, particularly Asia, it's important that folks eat more of sauce than the food. You'll be shocked. They'll give you food, and then many a time there isn't no food. There is sauce and veggies and fruits, and there's no food. Hmm? You see, if you have to give a food, they'll give you very little rice. And no wonder these people live up to 86 years. Japan have a lifespan of 86 years. These guys don't die. They don't die, and yet we pray more than they do. We have better food than they have, but simply because we lack knowledge of how to use this food, that's why we suffer from these conditions. So adopt this plate. Eat plenty of proteins, eat lots of veggies, eat lots of fruits, eat little of carbs. When you do that, trust me, your sugars will be reduced and will be checked. Now, every time a sugar is sugar. What I mean sugar is that like how you see crystal sugar, the one we add in tea, the white sugar. The white sugar there's no nutrient in it. You get the point. It's called an empty calorie. So, and the moment a sugar is alone, the speed at which it will run to your blood is quick. You see, you've seen folks, athletes, when they're running and maybe get a little bit hypoglycemic. The first thing they give them is glucose. Why? They don't give them a fruit. No, the fruit may take long. They may die. So the first thing they give them is glucose. Why? Because the glucose, pyum, pyum, it's quick. You get the point? It's quick. And that's the danger about empty calories or refined sugars. They quickly run to your blood, and we don't want that. If sugar should go to your blood, it should go there slowly and steadily. Why? Because every time it's quick, it triggers off insulin production. Boom, boom. The more insulin production you have, that kind of like produce. Eventually, it will give way, and that's a little bit detrimental. We don't want that. The other important food that we need to look at is oils and fats. Oils and fats, the important nutrient. I told you there were three important nutrients. Every time we're designing a diet, we look at three. You get the point? Every time we design the diet or diet for any person, we're looking at three nutrients. We've looked at salt and sodium, we've looked at carbs, and now we want to look at the oils. Very important, you know. Now, oils and fats, we have basically oils and fats. Oils are basically liquid at room temperature, and fats are usually, solid at room temperature. Now, what we usually recommend are the oils, the liquid oils, unsaturated oils, and monounsaturated oils, the likes of olive oil, the likes of sunflower oil, sunset oil, basically the liquids. And they clear the liquid oil, or they clear the oil, the better. Once an oil is easily transparent, if an oil is clear, like clean, that means it has less of saturated fat, less of cholesterol. You're hearing me? So they clear the oil, the better. And surprisingly, some of these oils are amazing, especially olive oil. Even their heat capacity is high. If you use it to fry something, they think, you know, cooks very fast. It does cook very fast. Well, because of there's no resistance, there's a high heat capacity. So they clear the oil the better. If you must use an oil, then it's important that you use an monounsaturated oil or a polyunsaturated oil. Basically, unsaturated oils, especially liquid oils that are clearer. Now we have some folks will tell you plant-based oil. There are plant-based oils that are a little bit opaque and solid, even at room temperature. Now, don't use those. Even much as they are plant-based, they could be having high cholesterol. Why? Because they're not clear. So the trick here is the clear the oil, the better. You get the point. Once an oil is not clear, like how you see margarine or how you see ghee and stuff like that, don't use it. Of course, you're going to hear people say that, I've been using this for a long time, but I'm okay. Well, that could be true, but other factors, you've not told us other factors. You're hearing me? But in a nutshell, you got to keep your oils clear as possible. So much that even if you use an oil and it change color a little bit, discard it. It's important to discard it, you know. Yeah, don't use oils that are not clear. Solid oils, ghee, margarine should be a no-go area. While they not be having high cholesterol, they not be having, trans fatty acids, and those are all predisposing factors for high cholesterol and your vessels being clogged with cholesterol and becoming, you know, terrible, and eventually you get hypertension. So it's important. Yes. The other important thing is that we want to look at some of the foods. You've heard about, especially herbs. Folks on the market herbs, claiming that these herbs are good for hypertension. Actually, recently, the guys who were marketing some herbs and they brought a lot of trouble to some of our bosses, claiming that our bosses had endorsed them and stuff like that, which was a little bit so bad. Now, some herbs, of course, could be good. Could, the word could, not are good. You get the point. Could be good, but of course we don't recommend them. Why? Because they have not been fully studied, scientific full study. But however, we have some foods that have been known to work as good as probably some medicine, to some extent, not of course to fully extent. You get the point. Like I told you, we have foods that are so known. For instance, well, one of the drugs we use to treat our patients is anticoagulation, anticoagulants. Anticoagulants are basically used in blood clotting. If somebody came in with probably a clot, a thrombus, or maybe DVT, different thrombosis and stuff like that. One of the drugs we use are anticoagulation to try to dissolve the clot. You get the point? But we have some foods that are known to have anticoagulation effects. You're hearing me? Because and you've also known sometimes that when people are probably traveling or get a certain age, sometimes they are given some drugs to prevent them from getting clots. You get the point? But apart from that, we have also drugs that are known to have anticoagulation effects, some rather foods that are known to have anticoagulation effects. So I would think it's important to embrace those foods. Peradventure, a clot could be trying to come out. You get a point. For preventive purposes. Foods like garlic, very, very key, very important, very good for it's a very good anticoagulation. It has an element called allicin, and allicin is a very good anticoagulation. So adding garlic in your food could help you avoid, clots in your body. Very, very important. You're hearing me? So foods like beetroot, beetroots are very good for anticoagulation. You get the point. You don't use them as anticoagulants in case you're seen with a clot. That would be a little bit late, much as it's still a little bit of it could help to lessen the dosage, but of course, at your doctor's advice. Now, don't do these things by yourself. You see, if you're not coagulation already, maybe you're taking so many milligrams of warfarin or so many milligrams of particular, anticoagulation. It's important to discuss with your doctor, cardiologist, and find out, doctor, there is this food which is good in anticoagulation as well. Could I use it alongside this? And then maybe your doctor could discuss it and see how much you should use and how much not to use. By so doing, this could help you lessen the drugs. You hear what I'm saying? Lessen the what? The drugs. Very, very important. So we have very key things. Now, we have also foods high in potassium. You've heard about potassium, like bananas, like avocado. You hearing me? Avocado, bananas, what is? Most of fruits have potassium, but high in avocado and bananas. Now, if you're taking high potassium foods like this, they're very important. Potassium, so it has a counter-interactive effect on sodium. The more potassium you take, the more you counter-interact sodium. It helps the kidneys to kick off the sodium. The kidneys kick off the sodium quickly, when you take high potassium. And potassium is not to be good for the heart. You're hearing me? Of course, in normal ranges, not in high ranges. You're hearing that. Good for the heart. You get the point. So when you take some of these foods, it's important. You also know, we heard about diuretics. I talked about diuretics earlier. Diuretics which are used in reducing the free BP down. They're foods which are good diuretics as well. Foods like celery, very good diuretics. You know, Celery. Foods like asparagus. Foods like parsley. These are veggies. Surprisingly, they're not carbs. They're veggies. Very important. That means if you took and embrace some of these foods very, very well, you're going to have a very, very good effect on your hypertension. Remember, like we said, not everybody treating hypertension is having it controlled, meaning that drugs alone may not control blood pressure. Some folks are like, after all, I'm on drugs, I'm by this drug and stuff. So now listen to this. Drugs alone may not manage your hypertension. They have to be used hand in hand with lifestyle changes and hand in hand with nutrition, especially nutrition, very important. Very, very important. You're hearing? We've had also we've had drugs like calcium channel blockers, those who fall under that category, the likes of amlodipine. You get the point. They block off the calcium from entering your arteries and maybe to your heart. And by so doing, they reduce the BP. You get the point. Of course, calcium, when it goes to the calcium channels in the artery, will cause vasoconstriction and hence, boom, blood pressure will go high. You're hearing that. But now, when you take these drugs, they block off that, and then there's vasodilation, and then the BP will go low. Now, we have foods that can do that. And these are basically veggies. They do that very, very well. You get the point. But still, they can't replace your drugs. Notice that they can't replace your drugs. You can use them alongside your drugs. You hear it? You can use them alongside your what? Your drugs. I hope that point's taken very well. Yeah, you can use them alongside your what? Your drugs. They'll help the doctor to reduce. You remember some of these drugs have challenges like calcium channel blockers. Most of the times they'll result to edema. You hearing me? And that's why they're not used for some patients like in heart failure and stuff. So, but if you take it alongside with food, proper food, like in the ones which have that blockage, ingredient in it, you'll help your cardiologist reduce the dosage of the drugs is giving. And by so doing, you'll be doing well. You'll do well. You will respond to the medication very, very well. The other important thing we didn't look at is stress. Stress is terrible, terrible. Every time you're stressed, the adrenal glands release adrenaline, adrenaline, that frightening thing, that hormone. And that hormone, guess what? It causes vasoconstriction and heart contraction, and boom, the BP goes high. You hear it? Yeah, yeah. So it's important to reduce stress as much as possible. Make sure you don't get stressed. And if you get stressed, figure out a way how to control it. You know, be happy, smile, laugh, jump, do exercise and stuff like that. Manage your stress very well. I will wind up with this. A few years ago, about close to 6 years ago, I was sent a patient. Some doctor recommended a patient to me. So I was referred to a patient. This patient, despite the drug, despite the nutrition, it was constantly high, the nutrition. And I asked her, why do you think your BP goes high? We went deep into dialogue. And guess what? She began to tell me all the issues she had. She was really stressed. She was so much stressed. You hear me? Now, the stress couldn't allow her BP. So, stress is so key. So, as I wind up, above all, make sure you're happy all the time, irrespective of what you know. Thank you.
Thank you so much. That's this good presentation. I know people have benefited, people have learned. I'm speaking about something which all of us have seen. We've seen it with our relatives, our friends, the people we know. But managing it is something everyone has been asking for that. But now, when we get such people like you to come talk to this, then you are hoping many will fall today. With that said, we shall have some questions. The CPD link will be shared. Just keep your eye on the chat. At this point, if you have a question, you unmute, put it to Denis. He will answer. But with that, I'll pick a few questions coming before the chat. Decide. Thank you, Doctor. At which hospital can one make an appointment? Thank you. When babies what's the difference between refined sugar, that's sugar crystal, and rich sugar? It seems it all contains fructose. What is metabolized the same way? Otherwise, thank you for the presentation. So you could answer to those. Then I'll pick more questions. This one, so on.
There's some voice coming out. I don't know who that is, but I pray you mute your, computer or stuff like that. Now, Gerard Mwebeza, she asked, which hospital you come from? I come from Uganda Heart Institute. Uganda Heart Institute is right now we're located in Mulago, Ward 1C, 2C, and 6C. But soon, in a few years, about 1 year, we shall be shifting to our new home in Naguru. We're constructing a very serious state-of-the-art hospital in Naguru. So yeah. So in a few years, it's been constructed now. Yeah, it's the hospital mandated to manage and oversee and supervise all hospitals. We have an act of parliament to supervise all hospitals in the country regarding cardiovascular diseases. We have the experts there. Yeah, this is a super specialized place. So that's where I come from. And I had a nutrition department there. This other question is what now is somebody was asking about refined sugars and fructose and stuff. Now, the difference between refined sugars most of the time they have crystal sugar, they have only glucose. Yes, they could be metabolized the same way and stuff like that, but fructose usually is in fruits, and fruits come along with other nutrients. Now, the danger here is that refined sugars or crystal sugar is only one. It's a glucose, one like this. So the speed at which it goes through the digestion system to your blood is quicker than the fructose sugar, which has other components around it, such as vitamins and minerals and stuff. So that's the difference. That is the difference. The other question is that thank you for the presentation. What should you say about carbonated drinks, milk, chicken, eggs in regard to control of hypertension? Uh, Very good. Most carbonated drinks have refined sugars. The carbon itself, the carbonation itself is not good, but also they come with refined sugars, they come with a lot of sodium as a preservative. Drinks like milk, chicken, eggs, it's not bad, especially if you take in moderation. Hmm? Milk is okay, high in calcium and good if you take in moderation. The most important thing is modified. For instance, milk, you could modify it and make it low fat milk. I mean, boil it, skim off the cream, and then dilute it to a ratio of 1 to 1. You could take that. Chicken, remove the skin, which is high in cholesterol. So you just modify it. Eggs, take the yolk out, which is high in cholesterol still. Modifying that stuff now. It's about this. Share the link. So yeah, basically that is it. Thank you very much.
Here is unmute
Oh.
and then
Any other question?
please ask. Okay, it seems people don't have questions who are on call. I will request that Dennis, you say your end remarks to the session, and I hope we can arrange have you to this. I'm going to share with you your certificate. I believe when I'm setting, I'm going to share your certificate from Professor Peter Oiswa for this wonderful presentation that you have made.
Yeah, yeah.
But lastly, as you give the closing remarks, Francis says, use AHA or WHO for hypertension. Then it's over to you.
We use WHO. WHO. We use WHO, World Health Organization, not American Heart Association. Yeah, but of course we collaborate with them, the American Heart Association as well. Yes. Uh, my last remarks. Thank you very much for listening to me, and I pray. We can kick hypertension out of the country. We can. At least we can reduce the prevalence. We can bring it down. Why would we die prematurely? Why would Africans suffer? You've heard that hypertension affects low and medium income and countries. Why? we have the best foods. We really have the best foods. We have enough property. We have enough land to do the physical exercise. So why would we suffer with hypertension? You and I, if we work hand in hand, we can kick the thing off. And most importantly, is to send a message all over the world. Let's talk to the people up country. Let's talk to everybody through media, through writing. Let's have outreaches. Let's spread the message. Let's proclaim the message of hypertension coming down. The other thing I would love to welcome you to the World Heart Day that is going to happen on 3rd October. Yeah, it's ideally supposed to be on the 29th of October, but because of some unavoidable circumstances, we had to push it on the 3rd of October. We're going to be in Entebbe, Mayor's Garden. That's where we shall be celebrating it from. Come and celebrate with us. Together, we can kick hypertension out of Uganda and Africa. God bless you and love you. Bye-bye.
Thank you, Dennis. Remember, thank you for joining in this important class. I know we can manage this hypertension. For those who want to meet Dennis, kindly find him at the Uganda Heart Institute. Then you'll be able to get meet members. We meet next Friday at the same time with another presentation.